So Dr. Drew, as you alluded to, that's the point where you started treating that inflammation phase, and then lo and behold, you develop a case of diverticulitis. What happened then?
Then I got on broad spectrum antibiotics. I had a weird experience. I'm not recommending this to anybody, but I was on a medication for anaerobic bacteria called Flagyl, which we use for diverticulitis, and it helped my lungs quite a bit. And I was reading lots of medical literature while I was lying there sick. And one of the things I've seen as late complications is lung abscesses. And I thought, maybe I was going in that direction. Maybe that really helped me. But the other reason I really wanted to get out there and talk about the inflammatory phase is I wanted people to understand that we should be educating people. I handled the whole thing in bed. My doctor didn't. I have to go anywhere. We use telemedicine. I signed up for an infusion of a monoclonal antibody, on day 4. A nurse showed up and infused me. It was all covered by insurance. It's covered by Medicare, Medicaid, everything. They can't distribute it fast enough. It's sitting on a shelf. 600,000 doses are sitting, being unused. And that for me, it stopped the progression. That was the part I really wanted to emphasize, that people should be aware they can have access to this and it can keep you out of the hospital. Talk to your doctor about steroids. Use telemedicine. Don't go running to emergency rooms. That's not the best place to get the care unless you desaturate or shortness of breath and really need it. So I'll tell you what, my infusion nurse took care of business right away, and I said, I'm going to report to you what I'm feeling because I'm feeling something extraordinary. Literally, colors are getting brighter. I'm feeling stronger during this infusion. And he said, I hear that all day. I hear that all day long. And I thought, wow, that is something.
And Dr. Drew, I'm glad that you pointed out that it's covered by Medicaid, Medicare, because I'm sure a lot of viewers are watching. They're saying, oh, well, he got it, but this is Dr. Drew and he's on TV.
That's right.
So I think that's important. And for viewers, the treatment that he got was given by way of IV. And it has been granted emergency use authorization by
Correct.
the FDA for mild and moderate COVID in some patients. So like he was saying, it's just important that that it's out there and you can talk to your doctor about it if you have mild or moderate COVID to see if by chance you would be a good patient for this particular treatment.
100%, 100%, and that you can anticipate it having a very beneficial therapeutic effect. Again, just based on my experience, I'm a case of one, but when my infusion nurse told me he's hearing that constantly, I thought, oh yeah, this is important for people to know about.
So it's not a good fit for everybody, but know about it. Ask your doctor; they can let you know.
Precisely.
I want to ask: at any point, did you become fearful?
So that was a really common question I got, and I was actually kind of confused by that question when I was foggier. Later on, people started asking me again, "Were you scared?" And I thought, "Why? As long as I stay out of the hospital, I have a 99% probability of surviving this thing. Why would I be scared?" However, I knew that if I ended up in the hospital, the numbers change. So my goal was to stay out of the hospital.
The numbers change because people who go to the hospital are sicker.
Yeah.
Right.
And so
I just didn't want viewers to hear that and think, oh, as long as I don't go to the hospital, I'll be fine.
No. You're so right. Thank you for clarifying that. But in my mind, my goal was to stay out of the hospital, to not get so sick I needed to go. And as long as I stayed there, I was not afraid.
Dr. Drew, that was my next question. So after 5 weeks, you became a, quote, long hauler. Let's take a look how you documented that.
Okay, I thought I'd give a little update. I am technically a long hauler now. I am at week number 5 and still having tremendous amounts of weakness and fogginess and cough and shortness of breath and all the stuff that you hear about. Numbness and tingling in my hands and feet and around my mouth and things. It's interesting. The word finding difficulty, head fogginess, stuttering, headache, sleep disturbance, all this stuff still going on. But I think a little better. The problem is that whenever I do anything, I have to lie down and rest. Anything. It's just I can't tolerate any activity.
I'm mostly back now. I just can't tolerate my normal level of activity. I still have some weird neurological stuff, but I'm really close to back.